The CyberKnife represents, I think, the end result of a lot of different efforts to try to deliver radiation as precisely as possible. And so the CyberKnife, in terms of the treatment, it goes through all those planning steps that I just mentioned, but the CyberKnife really has superior treatment delivery in that it uses however many, up to over 1,000 individual beamlets that we in the computer choose to use to attack the tumor. And it can do so very, very precisely, down to less than 1 millimeter precision. And the way that precision is obtained is not only with excellent planning through the planning system that comes with the CyberKnife, and also using the precise number of beams that we need to use to deliver the radiation, but also there is imaging in the form of X-ray imaging that goes on every few seconds while the treatment is actually being delivered. And there is a double check between the image that's taken at the time of the treatment and the image that was taken at the time of treatment planning, and those two are compared with the computer and with the naked eye to ensure that there's been no movement of any of the structures. It is definitely an outpatient procedure. It is not intended in any way to require inpatient hospitalization. The patients come in depending on what they're being treated for. Usually they are driven to the appointment, but in some cases they can actually drive themselves. As I said, they don't feel any side effects at all during the treatments, and so they go home the same day of treatment and usually feel the same way on the way home as they did on the way in. The success rate is quite good. It is much better than anything we've had before for the vast majority of the conditions that we're treating the patients with this technology. Depending on what the circumstances are, the results can be, close to 90 to 100% effective, or they can be, a little bit lower depending on what we're trying to treat.